Okay, this video is, do white blood cells cause hypertension? And the answer is yes, and it's interesting. I'm just going to give you a little teaser of something coming up in the future. This is a neutrophil undergoing netosis, and it looks like a giant squid. When a neutrophil is activated by something, for example, LPS, bacterial endotoxins, it can release its inner contents, its nucleus with all its DNA, and it's also, these little beads are like antimicrobial particles to trap bacteria, to immobilize them, and then to remove them from the system, the KILL them, okay? So that's kind of a cool thing, but these netoses, they're called net traps, neutrophil extracellular traps, NET, nets. They also will cause hypertension. I'm not gonna go into all of that today, but the point I wanna make is meat-based diet causes a lot more inflammation, including more netosis, and that causes hypertension. There's multiple reasons why a high meat diet causes hypertension, but I'm just letting you know about netosis for future reference. Netosis is a big, interesting subject. We're going to cover that more in future lectures. For today, I just want to do some bread and butter stuff, okay? This is erythrocytes, red blood cells, average size about 7 microns. So here's a red blood cell, about 7 microns. Neutrophils are the most common white blood cell. Neutrophils are about 14 microns. These are the numbers you want to remember. 7 microns for a red blood cell. You need to know that. 14 microns, 1 and 4. 14 microns for a neutrophil. So it's twice as big as a red blood cell. And a capillary is about 5 microns. You need to know those numbers because all of blood flow relates to knowing those numbers. Okay, so then if you have a bridging molecule, something that sticks the red blood cells together, it could be fibrinogen, could be LDL cholesterol, it sticks all the red blood cells together like a submarine sandwich. It's harder to push them through the capillary. You can also imagine a red blood cell, even under optimal conditions, has to deform a little bit to fit through a capillary because it's 7 microns and the capillary is only 5 microns. Well, you can imagine that a neutrophil, twice as big as a red blood cells, it really has to squish itself. You know, it's like doing a limbo to get through a capillary. Okay, usually, you know, over 99% of your blood cells in your blood are red blood cells. But when you eat a meat-based diet, you have a higher white blood cell count. And that can also raise blood pressure just because you have to push these bigger cells through capillaries, requires increased pumping pressure. Okay. Of course, we know high-fat diets and high-sodium diets are major causes of hypertension. All right. Other reasons why meat is so inflammatory is it causes other problems. Like it increases the incidence of leaky gut. When you get leaky gut, you get more bacterial endotoxins getting across the gut barrier. Those endotoxins cause amyloid clotting. They can also cause neuroinflammation. They can also cause activation of neutrophils. The saturated fat, which is associated with meat, causes increased activation of neutrophils. I gave entire lectures on that stuff before. Meat eaters have higher white blood cell counts than vegans. And it's even thought that they should use separate categories for vegans versus for meat eaters because the vegans just have significantly lower white blood cell counts. All right. Now here's a paper called A Link Between White Blood Cell Count and Blood Pressure. And of course there is one, okay? Here's the author's name is Suda, and he just goes on through paper after paper. Initial white blood cell count related to hypertension. Higher white blood cell counts related to hypertension. And all the different ethnicities. Whatever ethnicity it is, they're going to get the same thing. Higher white blood cell counts, so it's not genetic. Okay, and then they also found it's not just higher white blood cell counts, it's higher neutrophils to lymphocyte ratio. Neutrophils normally are about 2/3 of the blood cells you have, like about 65% of your white blood cells, okay? And they find the same thing in women, and the same diet has increased cardiovascular risk. So you can see the confounding variable here. Is it because the neutrophils are elevated? Is it because you get increased neutrophils with meat and it's really something else in the meat, the saturated fat? Is it the high animal protein? They're all bad things for health and for blood flow, okay? But I'm just drawing this picture because what I'm trying to say is meat isn't bad in about 1, 2, 3, 4, 5, 6, 10. It's like bad in 40 different ways. And really, when I was young, I would have thought meat was great and all this vegan stuff was nonsense. It's just the way it is. When you study health, meat comes out looking bad, plant foods come out looking good. Okay, we talked about zeta potential before, negative charge around the outer surface of red blood cells, so that way they repel each other so stuff doesn't stick together. Positively charged molecules of large enough size like fibrinogen, the clotting protein, LDL cholesterol, which is elevated by eating meat with the sat fat. acute infections with IgM antibody being elevated, uric acid being elevated from eating lots of high fructose corn syrup. All those things will serve as bridging molecules, sticking our BCs together. The reason you have a blood pressure is to get blood to your brain, the top of your brain, your cerebral cortex. So you have to pump it against gravity. If the blood is thick because of high LDL cholesterol or other bridging molecules or high hematocrit for whatever the reason, then you have to pump a milkshake up to your head instead of water, so pressure has to go up. If you eat a lot of sodium and you're vasoconstricted, you have to pump at a higher pressure to pump that blood through a constricted system. So you can see how it's double bad if you eat something like a cheese pizza, okay? It's full of fat, sticking the red blood cells together, giving you a rouleau formation, blood sludge, and on top of it, it's full of sodium, constricting your vessels. So now you're pumping a milkshake through a constricted system, pressure is going to go up, and your white blood cells are going to go up, and you're going to have more systemic inflammation. Yeah, we've all talked about this plenty of times. The Peter Quo, Pennsylvania cardiologist, 1950s, feeding patients, high sat fat, and later on, Meyer, Friedman, Ray, Rosenman repeated these studies with PUFAs, polyunsaturated fatty acids, and you get blood sludge, checking the blood lipids every 30 minutes, decreasing blood flow to tissue, increasing precipitating episodes of cardiac angina in the cardiac patients. Whereas when you feed them no fat, just a carbohydrate meal, you don't get any of this stuff. You don't get the blood sludge effect. You don't get the cardiac anginal episodes. Okay, neutrophils have a lot of chemicals. They've got granules, and they can release these granules. They're released in response to a high-fat diet, like sat fat. And these granules are the MPO, myeloperoxidase, help to catalyze the formation of bleach. It's a bleach-like material, hypochlorous acid that's used to kill bacteria, okay? So, but that MPO, we'll talk about, it's very cationic, meaning it's very positively charged. So when the neutrophils are activated, they release their MPO, myeloperoxidase. It drops down onto the endothelium. Endothelium has a glycocalyx. That means like sugar coating. What it really means is you have core proteins in the center, like these are the core proteins right here, these blue stalks. And then the things coming off the side are glycosaminoglycans, usually like heparin sulfate, which is basically a bunch of sulfates, very negatively charged, producing a zeta potential. The endothelial lining has a zeta potential, a negative charged surface to repel the red blood cells so they don't stick together, so they don't clot. It also repels the WBCs, the white blood cells, because they also have a zeta potential, a glycocalyx with lots of sulfates, negative charge. You also get a little bit of negative charge from the sialic acids at the end of the glycosaminoglycans. You get a little bit from the cholesterol sulfate, but the heparin sulfates are the big thing, making these things have a zeta potential and thus preventing all the stuff from sticking together. They also make it smoother. We don't need to go into all the details, but the water forms a dipole with its hydrogens being slightly positive charged, its oxygen negatively charged, that sits right along the glycocalyx, and it lubricates it, like the old expression, slippery when wet. Okay. And you can see this is not good because once you collapse down this glycocalyx, you can see the cations collapse it down from the MPO, myeloperoxidase. Now the adhesion molecules are exposed and the neutrophils will bind to them and other cells can bind to them, and it's a problem. Okay, I'll show you a picture of that. Okay, this is just more of the same, myeloperoxidase. So here's a normal glycocalyx sticking up the way it should be, negatively charged, nothing's going to stick to that. The MPO collapses it down, and now neutrophils can adhere to these adhesion molecules, and you'll even shed the glycocalyx to some extent. That's all bad. If you inject heparin, the heparin will have negative charges on it. Heparin spelled with an IN, heparin, I-N, rather than heparan, like heparan sulfate, glycosaminoglycan spelled with an A-N. But they both have negative charges, and those negative charges will help to bounce the MPOs off the glycocalyx to restore it. Okay, here's just showing that if you've trashed the glycocalyx and you now have exposed adhesion molecules, the neutrophils can bind to it and even sort of start to induce inflammation and try to go subendothelial. Okay, so it's a bad thing. You don't want these neutrophils being activated. We've also previously talked about how a high-fat diet, low in fiber diet increases leaky gut because you don't have diet fiber for the good bacteria to make the butyrates, the short-chain fatty acids used by the enterocytes to make tight junctions to prevent leaky gut. So the bacterial endotoxins like LPS from gram-negative bacteria, LTA from gram-positive bacteria. LPS is lipopolysaccharide, LTA is lipoteichoic acid. They get into the blood. They cause the fibrinogen to change shape from alpha helices to beta-pleated sheets, and they stack up to make amyloid clots, all right? That's amyloid clotting. That also makes the blood thicker, increases blood viscosity. If the person's iron overloaded, as men tend to be in their 20s, women, and by the time they're about 60, that also causes amyloid clotting. It causes a change in the shape of the fibrinogen from alpha helix, secondary protein structure, to beta pleated sheets, which then adhere to each other, stack up, and form small clots, okay, amyloid clots. That's what an amyloid clot is, something that's changed its secondary protein structure. Okay, this is just some paper about that same thing. There was one other picture I wanted to show you. Oh, just that iron does it too, like I said, excessive free iron. Let's see if I got any more slides here. Okay, that's all I got. Okay, so the point was elevated WBC, which you get from being a meat eater, has all these secondary effects, and there's a bunch more we don't have time to go into, but I'm just saying is you're basically predisposing yourself to clotting. You clot the big arteries in the heart, you have a heart attack, but you clot the little ones and you have problems. You can get gradual progressive loss of cardiac muscle, gradual progressive loss of brain tissue, and dementia. It's all bad, so that's why I'm 100% vegan for health reasons completely. I hope you find that helpful.